the patient enters the RX number and they enter their date of birth. The date of birth validates who they are. And there's a variety of different alerts that are created at that point. So, for example, if the patient puts in a wrong date of birth, then they get a message indicating that the incorrect date of birth has been entered. If you're unable to find a script number, and there's a lot of other different scenarios that there. But basically what we're doing is that we are pulling and communicating, we're pulling information out of PK software and we're presenting those alerts to the patient. So if it says it can't find the date of birth then in PK, then that's what's presented to the patient, that it can't find the date of birth. So that's how a refill is entered. If everything's okay and we have validated the date of birth and the RX number are actually in the system, then the patient refill goes straight through to your to-do list. Let's just talk a little bit about refill reminders and how they're set up. So again, patient puts in a script number, they put in a date of birth, that's all okay. Then basically RX Mobility is pulling from PK. It pulls relevant details about the patient from PK software. And one of the pieces of information is that it looks at the day's supply field in PK software and basically creates a refill frequency or refill period. And you can just see it highlighted here in the app. It says every 30 days that the patient is going to receive an automatic refill reminder. You as a pharmacist, you don't need to do anything. It just happens. Once the patient has put in the refill, the script number, the date of birth, then that happens for that script. It just happens automatically. They receive a push message straight into their device. It comes into their push message center like anything would, like a Facebook message or like something from Gmail or CNN or Fox News. Any of those apps that you have on your phone that are sending you push messages, it comes in exactly the same way. And the message is identified as coming from your pharmacy with your pharmacy logo and with your name. So in this particular instance, they'll receive an automatic refill reminder driven by the PK field, day supply field outstanding. They will also have information telling them the number of refills remaining. And again, this is driven by PK. So not only is the patient getting more information, getting automated refills, they're also getting information on the refill frequency and they're getting information on the number of refills remaining. So that comes through on the app as well when they look at the app details screen. That's the refill, how the refill reminder operates. A couple of different scenarios, and there's lots of scenarios, but I'm going to give you a sense of the type of scenarios that example. For example, there's no refills. A patient has no refills. Well then, if there's no refills remaining, then an alert is sent. Once they enter the script number and their date of birth, an alert is sent to them pretty much immediately. It's instantaneous. It happens within 2 seconds that no refills are remaining. And that's one particular scenario. Another scenario is, for example, if you've got a patient on long-term medication and they have, let's say, a script that's valid for 6 months and you want to just extend that script, well then you can actually, in PK software, you create a new script, a number from an old one. And automatically in RX Mobility then we update the new script number and we communicate that to the patient via the app. So if there's a new RX number applied to an old refill, then it just follows the actual, it follows PK and it pulls that information and presents it to the patient automatically. Let me go on to another screen for you. Script alerts from PK software then, there's a couple of different scenarios that occur when you are managing scripts. So they're sent automatically, and as Troy indicated, it can be from RX Watch, location tracker, or at the point of validation whenever you are dispensing. There's a couple of scenarios. Again, it's completed, and so you've scanned it at the completion station in in location tracking, or you've updated RX Watch, or you have the point of validation. And what happens at that point again is that the actual message is sent automatically as an alert, and this is one I just highlighted here. It says the order is complete. And that particular alert is actually connected directly into the mobile app screen, the mobile app, and directly connected into that script itself. So if the patient clicks on it, even if the app isn't opened, it opens the app and it opens the relevant script and it's sent automatically. And of course, the other scenario is it's rejected. And if the script is removed from the to-do list without filling, then again, it sends a message back to the patient that the order has been rejected. And again, that's an automatic thing that's sent through to the patient.